Have you ever been confused about the anatomy down there? If you're either having intercourse or making love to somebody with a vulva, or you own one yourself, today we're going to talk about all you need to know about female anatomy. Make sure you stick around till the end of the video because I'm going to talk about what exactly is this infamous G-spot and what should you know about it. If you're new here, I'm a board-certified urologist and I make urologic educational content on sexual education, bladder health, and much, much more. So make sure you subscribe and share this video with your friends. The foundation: how we develop. Before diving into the specifics of anatomy, it's important to understand how we develop. For simplicity's sake in this video, I'm going to refer to anybody with a penis as a male and anybody with a vulva as a female. When a fetus is getting developed in the uterus, so when someone's pregnant and their baby is developing, during the first 8 weeks, we don't have any genitals yet. This might surprise you, but at this early stage, all fetuses look the same in terms of genital development. The fetus has two distinct things that will eventually develop into either female or male anatomy, and that is a genital tubercle and a urogenital sinus. These are the building blocks, if you will, of what will become the external genitalia. Think of them as the raw materials that the body will shape and form based on the genetic instructions it receives. At this stage, there's no visible difference between what will become male or female anatomy. It's all the same starting point. At about 10 weeks, the fetus starts developing male or female external genitalia depending on what genes the baby has. So if they are XX, they're going to develop into a female, and if they're XY, they're going to develop into a male. This is when the differentiation really begins and those identical structures start taking different paths. The genital tubercle, as you can see in anatomical diagrams, develops into the head of the penis in the male and the head of the clitoris in the female. This is absolutely fascinating because it means that what might seem like completely different structures in adult bodies actually came from the exact same tissue in early development. Homologous structures. The shared blueprint. Because these structures develop from the original urogenital sinus and genital tubercle that were identical in both fetuses, they will have what's called homologous structures, and what that means is that they're developed from the same embryological tissue. They have very similar function, structure, and location in the body. So in men and women, the head of the penis and the clitoris develop from the same tissues. This is why they share so many characteristics, including their incredible sensitivity, as well as the hood of the clitoris and the foreskin of the penis. These are also homologous structures that serve similar protective functions. And then when you look at the lips of the labia, or the outer and inner lips of the vagina, the scrotum is actually analogous or similar to the outer lips of the vagina, and that's called the labia majora. If you look closely at the texture and structure of scrotal skin, you can actually see the similarities to the labia majora. They're made from the same tissue that just developed along different pathways. Understanding these connections helps us see that male and female anatomy aren't separate, unrelated things. They're variations on the same developmental theme, like two different recipes made from the same basic ingredients.
The vulva, what you see on the outside. So everything you see in anatomical pictures of external female genitalia is called the vulva. It's important to note that vulva and vagina are not the same thing. The vulva refers to all the external structures, while the vagina is the internal canal. At the very top, you see the clitoris, and that is, again, as I mentioned, analogous to the male penis, the head of the penis specifically. And so it's full of tons of nerve endings. In fact, it has approximately 8,000 nerve endings concentrated in a very small area, which makes it one of the most sensitive parts of the human body. Very commonly, stimulation of the clitoris will result in orgasm for women, similar to how men need penile stimulation to have orgasms as well. This makes complete sense when you understand that these structures are embryologically identical. They're wired for pleasure in the same way. It has a hood as well, and you can see that's called the prepuce. The prepuce can be covering the clitoris and can be moved back and forth, similar to the foreskin of the penis. This hood serves a protective function, keeping the highly sensitive glands of the clitoris covered when it's not being stimulated. Interestingly, sometimes the hood of the clitoris can actually get adhesions or stuck to the top of the clitoris, and in some people this can cause some pain. This can happen due to buildup of natural secretions or from lack of gentle movement of the hood. If someone experiences pain in this area, it's worth discussing with a healthcare provider because it's often treatable. The clitoris. So much more than meets the eye. Before we move on to the other anatomy, let's get a little bit deeper into the clitoris because this is truly a remarkable structure that deserves its own section. Interestingly, the word clitoris is actually derived from the Greek word clitoris, or kleis, which means key by which one enters the door. Very interesting when you think about it. The ancient Greeks understood that this structure was somehow key to female pleasure and sexuality. The clitoris is exactly identical embryologically to the penis, the head and the shaft of the penis. And while it looks pretty small, and you only see a very small part of the clitoris when you look at the external anatomy, just that little button-like structure at the top of the vulva, when you actually look at the entire internal part of the clitoris, and here you can see a picture of it in anatomical diagrams, it's actually quite long and bifurcates, very similar to how the erectile tissue of the penis does. The external part of the clitoris is really just the tip of the iceberg. The internal structure extends back into the body and then splits into two legs called the crura that extend along both sides of the vaginal opening. This means the clitoris is actually much, much larger than what you can see externally. And in fact, when you look at studies where they've actually done anatomical dissections, it is identical to the nerves and the blood vessels to the penis. The same types of nerves, the same patterns of blood flow, it's all remarkably similar. Similar to the penis also, the clitoris can get enlarged and engorged with blood during arousal and have tumescence, very similar to what happens during an erection in a male. And I described that in my video about sildenafil and tadalafil if you want to learn a little bit more about what happens during an erection for a man. The same physiological process of blood flow increasing to erectile tissue happens in both structures. And here you can see that all of this erectile tissue covers the urethral opening and the vaginal opening and goes out to the sides. So that is also right underneath some of the inner lips of the vagina, or the labia minora. And so some people can find those areas to be very sensitive as well. This extensive network of sensitive tissue explains why different types of stimulation, whether direct or indirect, can be pleasurable. Beyond the clitoris, other important structures. Below the clitoris, you can see the urethral opening. The urethral opening is essentially the end of your pee tube. So your bladder makes urine and it exits the body through that tube at the urethral opening. It's a small opening and it's separate from the vagina, which is an important distinction. Below that, you can see the vagina itself. The vagina is a pretty amazing structure. The reason being is that it can change in shape dramatically. As you may know, when women have babies, it can get quite large to allow the passage of a baby through the birth canal. The vagina is incredibly elastic and designed to stretch significantly. But similarly, that's what happens during arousal. During arousal, it actually gets wider and longer, up to 3 inches longer when the person is aroused. This is part of a process called tenting, where the upper 2/3 of the vagina expand to accommodate penetration. The vagina also produces lubrication during arousal, which makes sexual activity more comfortable. The vaginal walls are muscular and lined with tissue that has folds called rugae, which allow for this expansion and contraction. It's a dynamic structure that adapts to different situations, whether that's sexual activity, childbirth, or just normal daily function. And then lastly, below all that, you can see the opening to the anus. In women, we always talk about having 3 openings or 3 holes. The urethra, which is at the very top, then the vagina in the middle, and lastly the anus at the bottom. Understanding this anatomy is important for hygiene, sexual health, and just general body awareness. The G-spot, separating fact from fiction. So as I mentioned throughout this video, the clitoris is analogous to the penis. So many women need clitoral stimulation in order to orgasm. But a lot of people talk about this thing called the G-spot. So what exactly is the G-spot? Is it real? Is it myth? Let's talk about what we actually know. It was actually identified in 1940 by Ernst Grafenberg. That's where the G comes from. It's located on the top of the vagina, or what we call the anterior wall of the vagina, about an inch or two inside the vagina. If you're facing someone, it would be on the front wall, toward the belly button side. A lot of people describe this as an area you can feel or find by putting a finger in the vagina and using a come hither motion, basically curling your finger upward toward the front wall of the vagina. However, it's not like a magic button that you can actually find and press. It's just an area where there's lots and lots of nerves, and it may feel slightly different in texture, sometimes described as slightly ridged or spongy. Interestingly, right above the vagina in this area is what we call the Skene's gland, and the Skene's gland is analogous or homologous to the male prostate. These are small glands that produce fluid and are located around the urethra and near this G-spot area. I've previously talked about prostatic massage and how some people find this to be pleasurable, and similarly, some women may find massage of this area to be pleasurable as well.
However, is this G-spot the holy grail of female pleasure? Well, for some women, they are able to orgasm with penetration and stimulation to the G-spot. But, and this is important, for most women, clitoral stimulation is required for orgasm to happen. Because, like I've described in this entire video, the clitoris is basically the same sensitivity, the same tissue structure as the male penis, and so women need clitoral stimulation very often in order to reach orgasm. Studies have shown that only about 18% of women can orgasm from penetration alone, while the vast majority need some form of clitoral stimulation. This doesn't mean there's anything wrong, it's just how the anatomy works. The G-spot can provide additional pleasure for some people, but it's not a requirement for sexual satisfaction, and not everyone finds it particularly sensitive. Bringing it all together. Understanding female anatomy is about more than just knowing names and locations. It's about understanding how everything connects and functions together. When we understand that male and female anatomy develop from the same structures and share so many similarities, we can better appreciate how the body works and why certain types of stimulation feel the way they do. The key takeaway is that the clitoris, with its thousands of nerve endings and extensive internal structure, is the primary pleasure center for most people with vulvas. The G-spot may provide additional pleasure, but it's not a magic button that works the same way for everyone. I hope you guys enjoyed this introduction to female anatomy. In my next video on female sexual health, I'm going to be talking about female ejaculation, so make sure you subscribe and don't miss that one. And as always, take care of yourself because you are worth it.